Welcome everybody. My name is Gordon McVie and I'm the Managing Editor of ecancer Medical Science. I also work at the European Institute of Oncology. I'm also an old age pensioner, drawing pensions from various places where I've worked in the past. And so I'm past my sell-by date. So I've got time to come here and I can even withhold lunch. I do apologize for having to get the lunchtime slot, but some of you have sensibly brought your lunch. That's the American trick. You always have your important meetings at lunchtime and serve lunch, and everybody comes. So thank you very much, everybody, for coming. This is quite an unusual meeting. It's the first time ecancer has hosted a satellite, and we've done that as the dissemination partner of a very, very important, strategic and functionally important FP7 project called Eurocan Platform, which is chaired by Ulrich Ringberg. But the credit has got to go to Ulrich and the president of EACR, Julia Celis, who's around somewhere, for driving this Eurocan Platform project together. It's linking up the top 20 or so blue chip cancer institutes in Europe to establish a really important engine for change and for translational science in Europe. We aim to be as competitive as any other continent in the world in the next couple of years, but we're doing pretty well so far. And then in discussions in the Eurocan Platform, it's been quite clear that the progress is really fast, and we felt that it was worthwhile just taking one step to the side, not backwards, but to the side of the translational research revolution, which is leading to personalized medicine, and look at the cost of it. Patients are reading about personalized medicine and they're expecting that they're going to be cured by personalized medicine. Well, they may well be with a bit of luck in 10 or 15 years' time, but they may need to have an awful lot of money in their back pocket in order to be cured. And it's a question of, okay, can we afford this? At the last Eurocan Platform meeting, there was a ranting session from Professor Lex Egermont, an ex-ECHO president, who said, well, this is the most fantastic thing, this melanoma year. 2 years in melanoma and 2 fantastic drugs, 2 completely new drugs. One is ipilimumab, which is a completely new concept as an anti-T cell phenomenon. And it's not just melanoma, it'll work for everything, but who can afford it? And then there was this RAF stuff. What's this BRAF thing? Vefarufenib. I can't pronounce these things, I'm too old. But this drug hits BRAF mutated melanomas, and 50% of melanomas. And then he gave us the bad news. He said, well, in the randomized trials, we're talking a few months for one of them and a few months for the other one, and the grand cost will be about 100,000 euros. And that's when we start looking at cost and effectiveness. So he was essentially setting the tone of this meeting, and it's good that Ulrich Ringberg is here to tell us where we're going to go in the Eurocan Platform and European cancer research at the very end. And the stage will be set in terms of the European scene just before him by Richard Sullivan. We're going to have 3 science presentations to give you the flavour of how fast it's going and how exciting it's going to be. And each of the 3 speakers will be asked at the end, okay, who pays for it? Because that at the bottom of the line is what it's all about. The home team starts. Juan, thank you very much for organising this meeting as a leading light in the scientific committee. And tell us what you're doing here in Val d'Hebron, which is the other sponsor in the bottom right-hand corner here. All yours.